One fine morning, a guy was sitting in his office chair. Suddenly, his throat started itching. By evening, he started getting chills and was feeling feverish. Could it be cold or the flu? Or is there any difference between them in terms of symptoms, severity, and potential complications? The difference starts with the viral culprits that cause these respiratory disorders. For common cold, more than 200 different viral variants are known to cause it, and more than 50% of its occurrence are linked to rhinoviruses. Interestingly, 20 to 30% of its occurrence are actually caused by unknown viruses. That's why there is no vaccination available for common cold. You cannot make 200 different vaccines for the same illness. And even if you make it, practically you cannot give it to one individual 200 different vaccines. In terms of flu, which is the influenza, it is usually caused by two viruses, influenza type A and type B. They mutate pretty fast. In layman terms, they change their structure quite fast. And that is why vaccination every year is recommended for influenza. The other major difference lies in their onset and fever differences. For cold, the fever is quite rare. Usually it doesn't happen, but however, even if it happens, the fever is going to be pretty lesser than 100-degree Fahrenheit, and the symptoms are going to gradually onset. On day 1, you might experience some itchy throat. On day 2, some mild runny nose. On day 3, severe runny nose. By day 7, you will start feeling better. For flu, high fever is quite common. The fever ranges from 100 to 104-degree Fahrenheit. And the symptoms, they onset all of a sudden. In the morning, you might feel fine, but by evening, you just want to go visit a doctor. Intense chills happen all of a sudden. All you want to do is go to home, lie inside a blanket, and take good rest. The other major differences are body aches and fatigue. For cold, there are no aches at all, and you might experience some mild fatigue, which is the tiredness. For flu, body aches are going to be very severe. You're going to have excess headache as well, and the tiredness is going to be severe as well. Some people take whole 2 weeks to recover from flu. For children, they also experience some vomiting and nausea if they catch the flu. A lot of people confuse that flu and cold are same because of the common confusing symptoms. The common confusing symptoms include the cough, which is usually dry and induces a lot of mucus production, and the sore throat, which is often the first and primary symptom for a cold or a flu, and runny and stuffy nose that occurs in both flu and cold. The complications of a cold are basically nothing. You're just going to have some mild discomfort. No health issues results from cold. You can carry on your everyday work as usual. Whereas for flu, it can result in serious complication if not treated properly. Some include pneumonia, bronchitis, and sinus infections. If you are an individual who already have some lung infection, you have to be pretty careful about catching a flu. The other high risk groups include pregnant women, elderly who are above the age of 60, and infants and babies whose age range from 0 to 3. So, what are the treatment approaches? Take plenty of rest for both the cases. Have some fluids and stay hydrated. Also, get some over the counter medications for some symptom relief. However, for treatment, you can take viral medications, antiviral medications to combat early flu symptoms. If you have an itchy throat followed by a fever, it's better to first visit a doctor and get some antiviral medication so that you do not risk any serious complication that can come because of flu. Prevention is usually better than cure. Hence, it is recommended for all the high risk groups to vaccinate for flu every year. The key takeaways include, although flu and cold share some common overlapping symptoms, the cold the symptoms of cold gradually onset, and the symptoms are pretty localized. The nose, the throat, and your sinuses are usually the only regions that are affected by the cold. Hence, it is called the upper respiratory disorder, as all these parts lie up in the upper part of your body. Even flu is an upper respiratory disorder. However, in extreme cases, it can travel to the lung and it can cause you pneumonia and sinusitis. That time, it can become a lower respiratory disorder. And the symptoms are sudden, they are pretty severe, and your whole body is going to react. It's going to be a body wide symptom. Now, coming back to the question, a guy who was feeling fine in the morning started with an itchy throat, and by evening he was having some chills and feeling feverish. What could it be? If you have watched this video and understood, you would know the answer. Wear a mask to prevent the spreading of cold and flu to others in case you catch it. Take care.